Canine hip dysplasia, CHD, is a common orthopedic condition in dogs, causing a range of symptoms, from occasional limping to severe mobility problems. It's influenced by genetics and the environment, leading to osteoarthritis in the hip joint. Often dogs with CHD may seem normal at birth, but develop joint problems soon after. This video discusses the causes of CHD, including genetic and environmental factors, diagnosis, and treatment. Canine hip dysplasia, CHD, has historically been associated with various factors, including joint laxity, abnormalities in pelvic muscles, delayed femoral bone development, and incongruity between the acetabulum and femoral head. The exact trigger remains uncertain, but two main causes are now proposed: hip laxity and abnormal endochondral ossification. Both contribute to an unstable hip joint, leading to osteoarthritis, OA. The stability of the hip joint depends on the strength and compliance of the joint capsule and the conformation of the hip bones. Dysplastic hips show differences in collagen composition, suggesting a potential genetic or injury-related cause. CHD primarily impacts large breed dogs, although it can occur across all breeds. The prevalence within breeds varies widely, estimated between 1% to 75%. Symptoms of CHD typically manifest between 3 and 8 months of age, often accompanied by gait abnormalities or lameness. Diagnosis involves palpation and radiographic examination, which may reveal hip joint subluxation. The development of osteoarthritis, OA, is a common consequence, characterized by loss of articular cartilage, bony remodeling, and decreased joint function. The genetic component of CHD operates on a quantitative inheritance basis, meaning it's influenced by multiple genes and environmental factors. Heritability estimates for CHD vary, ranging from 0.1 to 0.68, with larger breeds showing a heritable tendency. Different dog breeds may exhibit varying susceptibilities to CHD, with some breeds tolerating more hip laxity than others. Breeding programs aimed at improving hip quality have shown success in controlled populations by combining individual phenotypic information with parental and offspring data to obtain estimated breeding values. However, the effectiveness of such programs can vary between countries and populations. Molecular genetic studies have identified potential QTLs associated with CHD, but there's ongoing research to fully understand the genetic mechanisms underlying the condition. Environmental factors play a significant role in the development and severity of canine hip dysplasia, CHD, in genetically predisposed dogs. These factors, while not causing CHD in dogs without genetic susceptibility, can exacerbate the condition in susceptible individuals. Various environmental influences include body size, growth rate, nutrition, dietary factors, hormonal influences during lactation, and exercise. High caloric intake, excess protein, and calcium consumption, as well as rapid growth rates, have been linked to increased severity of CHD. Maternal factors during lactation, such as the presence of growth-promoting peptides like relaxin and estrogen in milk, can affect joint development in offspring. For instance, dysplastic Labrador Retriever bitches produce milk with higher levels of relaxin and estrogen precursors, potentially influencing joint laxity in their offspring. Nutritional factors also play a crucial role, with overfeeding maximizing the expression of CHD traits in genetically susceptible dogs. Studies have shown that reducing food intake in puppies can significantly reduce the prevalence and severity of CHD and associated osteoarthritis. Additionally, perinatal nutrition can have long-term effects on metabolism and orthopedic health, with bottle feeding leading to reduced growth rates and lower incidence of CHD compared to ad libitum feeding. Besides nutrition, other environmental factors like exercise and the season of birth can influence CHD expression. Soft ground exercise during warmer seasons may support musculature development, potentially preventing CHD. However, conflicting results exist regarding the influence of gender on CHD expression, with studies reporting varied findings. Clinical presentation and diagnosis: dogs with canine hip dysplasia, CHD, typically present at two distinct ages, as young pups at 5 to 9 months old and as mature adults. Early signs may include discomfort on hip extension or abduction and a positive Ortolani sign. The Ortolani sign is a clinical test used to detect looseness or laxity of the hip joint. It can be performed with the dog under sedation or anesthesia to ensure muscle relaxation. The dog is placed in dorsal or lateral recumbency, and the examiner grasps the dog's stifle, flexes the hip joint to a 90-degree angle, and then slowly abducts the femur while applying gentle pressure to push the femoral head towards the acetabulum. A positive Ortolani sign is indicated by a palpable or audible click as the femoral head slips back into the acetabulum when the hip is abducted. This click signifies that the hip was partially dislocated and then reduced by the maneuver, suggesting hip laxity characteristic of hip dysplasia. As dogs age, compensatory mechanisms for subclinical lameness may become apparent. Radiography is the primary diagnostic tool for CHD, offering valuable insights into the likelihood of its development in young dogs. Radiographic evidence of OA may appear as early as 5 to 9 months of age in some cases, while in others, it may not be evident until later. Early changes, such as synovitis and cartilage abnormalities, may not be detectable through radiography alone. Arthroscopic evaluation reveals that not all dogs with articular lesions show radiographic evidence of OA, highlighting the limitations of radiographic diagnosis alone. Various radiographic techniques have been developed and studied extensively for their sensitivity and specificity in predicting CHD. Here are the 3 of the most common ones. Orthopedic Foundation for Animals, OFA, established in 1966 as a hip registry for dogs, and later for cats, evaluates various health parameters including hips, elbows, eyes, and thyroid. The extended hip ventrodorsal radiograph, in which the patient is positioned in dorsal recumbency with the pelvic limbs extended in parallel, is used for grading. It provides information on the presence and severity of osteoarthritis and subluxation but may be less accurate in younger dogs due to ongoing skeletal development. Each radiograph undergoes independent review by 3 veterinary radiologists and a consensus opinion is provided. Dogs over 2 years receive one of 7 grades based on radiographic appearance, ranging from excellent to severe hip dysplasia, each defined by specific anatomical characteristics and degrees of joint incongruity, subluxation, and degenerative joint disease. You can pause the video to read the details of the classification. The Norberg angle assesses the congruity of the hip joint by measuring the angle formed between the femoral neck axis and a line connecting the center of the femoral head to the cranial acetabular rim. A higher Norberg angle indicates better coverage of the femoral head by the acetabulum, suggesting a lower risk of CHD. Conversely, a lower Norberg angle indicates decreased coverage, indicating a higher risk of CHD and potential hip joint instability. This measurement is commonly utilized in conjunction with a morphological evaluation of joint congruity using the ventrodorsal hip extended radiographic and screening protocols of HD. Another method is the PennHip method, established by the Pennsylvania Hip Improvement Program in the 1980s, which involves the use of distraction and compression radiographs to assess joint laxity and can be conducted in puppies as young as 4 months of age. A custom-designed distraction device from Symbiotics Corporation is used to position the hips, with the patient in dorsal recumbency. It involves compressing and then distracting the hips to measure hip laxity, known as the distraction index, DI. Calculated by dividing the distance between the center of the femoral head and the center of the acetabulum by the radius of the femoral head. A DI range of 0.0 to 1.0 is used, with lower values indicating tighter hips. A DI of 0.3 or less is considered normal, while a DI greater than 0.4 suggests a higher likelihood of developing secondary degenerative joint disease. Veterinarians interested in utilizing this technique must undergo specialized training and certification. 2 different treatment options are commonly recommended for CHD: medical management and surgical management. Surgical options include procedures like juvenile pubic symphysiotosis, triple pelvic osteotomy, excision arthroplasty, and total hip replacement. Medical management offers a multifaceted approach aimed at both prevention and treatment of CHD-related osteoarthritis, OA. Preventative measures for genetically predisposed dogs include administering systemic polysulfated glycosaminoglycans, PSGAG, and limiting food intake. PSGAG is a chondroprotective agent, derived from bovine lung and tracheal tissue, that inhibits collagen and glycosaminoglycan degradation. Its administration during growth stages significantly reduces CHD progression and secondary OA. Limiting food intake from 8 weeks of age can reduce CHD severity. Weight reduction, physiotherapy to strengthen hip-supporting muscles, and nonsteroidal anti-inflammatory medications are recommended for dogs suffering from CHD-induced OA. Supplements containing glucosamine and chondroitin sulfate or PSGAG can be beneficial, especially in younger dogs.